Hello, welcome to LotusMedics. I'd like to introduce myself. I'm Dr. Sachin Kotasthane. I'm an obstetrician and gynecologist in New South Wales, Australia. I feel lucky to have been trained in 3 different countries and feel privileged to have received training from some of the best in their fields. My particular interests are advanced laparoscopy and minimal access surgery, pelvic floor reconstructive surgery, and high-risk obstetrics. Activities after laparoscopic hysterectomy or major laparoscopic surgery. Congratulations! Your laparoscopic hysterectomy has been successful. You're probably feeling great right now. And most people around you won't even believe that you've had major surgery. But wait, before you start doing too much too soon, restrain yourself. Here are some tips and general advice about activities after a laparoscopic hysterectomy. A laparoscopic hysterectomy is a minimally accessed surgery or a keyhole surgery wherein small keyholes or incisions are made on the abdomen and the uterus is removed. Which means you don't have a big scar on your abdomen, and you'll probably feel like most of these keyholes and the external healing has started to be completed after a few weeks. But wait, the internal healing is still ongoing and is still continuing, so you have to be careful. Especially the vaginal vault or the apex of the vagina, which is where once the uterus sat. This is still healing and can take a few weeks to a few months. Doing too much too soon can hamper the healing, cause secondary bleeding and infection, and in extreme cases you may have to go back to the hospital with bleeding and pain. This might, in rare instances, mean surgical treatment to take care of this bleeding. In very severe circumstances, you might have something called vault dehiscence, which is atop the vault giving away. This is a serious condition. All of this can be easily avoided. So what can women do, and what activities must be avoided in these first few weeks of surgery? All activities need to be done in a pelvic floor safe manner, and we must try and avoid any rises in the intra-abdominal pressure. Avoid activities like squatting and carrying heavy weights, no more than 5 kilograms. This includes activities like vacuuming, lifting heavy baskets of clothes, making beds, and carrying children. Cute as they may be, an average 3-year-old weighs anywhere between 13 and 16 kilograms. Avoid these activities for about 8 weeks. Also avoid exercises that are high impact, like running, jumping, burpees, and abdominal exercises like sit-ups and planks. Avoid heavy loaded exercises, anything that makes you hold your breath or grunt to lift. Avoid prolonged standing and take regular breaks. And also avoid spas and jacuzzis for about 8 weeks. A leisurely walk is your best option of exercise in these first few weeks. Avoid any intense sports and build your stamina slowly as you progress and as much as you can tolerate. Start slowly and take the help of an exercise physiologist or a physiotherapist. You can go out for lunch and dinner with your loved ones, but these mammoth shopping trips will certainly have to wait for a little bit. Another question I get asked a lot is about sexual intercourse. It has been found that having very early sexual intercourse, earlier than 8 weeks, can sometimes result in vault dehiscence, so you might have to wait on that for a few weeks. Don't forget, your body is still healing. It's in its healing process, and it's not unusual to feel tired. Your body is going to channel all its resources, whether it be nutrition and nourishment or rest and sleep, all towards your healing. So it's not unusual to feel this tired after surgery. Optimize your nutrition, eat fresh fruits and vegetables and a healthy, balanced diet. Avoid constipation and straining on your bowel movements. As far as bed rest is concerned, this doesn't mean that you have to be confined to bed. Excessive sedentary behavior has not only not proven to be unhelpful, but can actually be harmful and increase your risk of clots in the legs and lungs. Accept help. For those ladies who are used to being independent, accept help and allow your family and your friends and near ones to pamper you. You've deserved it. As far as dressings are concerned, you can shower with your dressings on, as most of them will be waterproof. Keep your wounds clean and dry. Don't pull or tug on the sutures. Sometimes it's not unusual when the wound contracts for a suture or two to pop out of the skin. If this happens and is being uncomfortable or catching on your clothes, you can put a simple plaster on it. For those who work from home, start slowly, take plenty of breaks in the first few weeks. Another important question I get asked is about driving. Usually women will be comfortable enough to start driving in the first 3 or 4 weeks. But be careful. To drive, you should be pain-free and not be taking any medications that make you feel drowsy. Before attempting to drive the car for the first time, practice your emergency stop in the driveway with the key in the ignition but not turned on. Have smaller trips to begin with and have someone in the car who can take over if you feel uncomfortable to drive. Check with your car insurance for your specific requirements. If you're experiencing any red flag symptoms, there's a video on the LotusMedics website on red flags. Please view this. Dr. Kotasthane is very happy to see you back for an earlier appointment than planned if you're facing any issues. If you're unwell, go to the nearest hospital. This information is only a guide. Different women will recover from the hysterectomy at different times and different rates. If the recovery feels slower, don't rush it. There are no rules for recovery. You will get back to normal, but be sensible and don't overdo it. We hope you found this video really useful. We at LotusMedics continue to give you evidence-based information about women's health so that you can make the best choices about your health. If you've liked this video, please share, like, and subscribe to our YouTube channel so that we can grow this channel and continue producing such educational videos to help your women's health needs. Thank you.